And we've got the last 2 sessions posted on our website and memorialized on YouTube. So if you have questions, you can go there and find them. The purpose of these forums is to provide an opportunity for you guys to ask questions about policy adjustments and for us to have targeted training when changes are implemented. So we hope to increase awareness and understanding of New Choices waiver policy and also increase our understanding of the challenges that you may be facing as a result of our policy. So through forums and ongoing communication, we think we will accomplish the goal of supporting healthy and safe independent living for New Choices waiver participants. So as usual, everyone is muted. And Google Meet will capture attendance for those who are signed in through video. If you are calling in, please report your attendance by listing your full name and the agency that you were with in the chat function. Again, that's only for those who are calling in to the training using the telephone number rather than the link that was provided with video capability. So at any time during the meeting, feel free to submit your questions through the chat function. Like I said, today's meeting will be recorded. And I appreciate those who are on camera. I can see some faces. I'm sure we've noticed that by now that verbal or nonverbal communication is often missed through these meetings. So I appreciate those whose faces I can see. We will do our best to answer all of your questions during the meeting, but if there's something we're not able to get to, we are capturing questions and we'll revisit those at a future training session. So please know that we are not ignoring you. We just want to be prepared with good answers at the time we address the questions. So for today, we have a couple of items we want to go over. First off, we have an update about the price per unit policy that we talked about last time. Your guys' feedback about that was very valuable, and I'm glad that we went through the exercise of having kind of a work group, a focus group surrounding it. So we are currently working through a different policy proposal and plan to implement that hopefully by July 1 or on July 1 to coincide with the new fiscal year. So in the meantime, the previous policy and draft of the service authorization at this point are just drafts. So please don't use them. You guys were so great and timely, quick communication was directed down to the DME providers. So we've clarified with them that case management agencies at this time are not required to enter prices into the care plan system, nor are you required to document the price per unit on a service authorization. It will just be as it has been at this time until we have another update. So there are some care plan system updates that have become noticeable. So in 2019, at that training, we provided a spreadsheet that listed all of the services and in what frequencies it should be listed so that there was a greater chance of it being approved the first time it was submitted. And after seeing how that worked over time, we decided that we could program the care plan system that way to only allow certain frequencies depending on the type of service. So all frequencies or all services have only one frequency option. The biggest challenge appears to be moving from a monthly frequency to a weekly frequency for T2003 and S5125, attendant care and non-medical transportation. So those are all now to be weekly frequencies. So when you are submitting annual care plans, it's our understanding that the previous care plan kind of pre-populates on your screen and you have the option to make changes. So you'll need to remember to go in and adjust the number of units. If, for example, there were 32 units of non-medical transportation per month on the last care plan, and it pre-populates again for the annual, you will need to make sure to go in and change that to 8 units weekly. Okay, so if there's any questions there, submit those in the chat function. Our goal with doing that was to reduce the rate of denials. We acknowledge that that exists on both sides, on our side, as well as on the submission side. So we're just hoping if we remove that element, it solves the problem. So I guess you'll also need to get into the habit of making sure service authorizations accurately reflect the new frequencies that are pre-programmed. If it's helpful, we can send out that spreadsheet again so you can reference those frequencies in advance of care plans. Let us know if that's something that you would like. All right, so the major topic for today is the changes to the PCCP Addendum. Announcing this training session, we sent out a link to a YouTube video that was prepared by a staff member in our bureau who is the settings rule technical assistance specialist at the Department of Health. And the goal of that video was to provide context into what the settings rule is. You know, we've talked about it, but translate that into how service delivery should change as a result of implementing the settings rule. And we've seen a little bit of that with memory care, or the memory care checklist. However, it may not have been clear exactly what we were trying to accomplish. So hopefully everyone here has had a chance to watch that video. Heather did a great job and made it easily understandable. It's not dry and boring like our annual CMA trainings are, so we're taking notes about how we can improve those for the future. But it's really great. She provides some context that that helps us conceptualize what person-centered care planning meetings can look like, what questions can be asked in order to define goals and identify what resources may be needed. So please start thinking of what questions you have related to the PCCP addendum and put those in the chat function. And just to stall, to give us some time, I'm going to review the high points of that training because it's been a few weeks since we sent the link out, so maybe we need a refresher. So feel free, put your questions in the chat function. We will get to them in just a minute. So the settings rule is a federal rule that governs where and how services are provided to individuals receiving services under a Medicaid home and community-based waiver, like New Choices waiver, aging waiver, physical disabilities waiver, etc. All services ultimately have to comply with this rule, and we have to demonstrate compliance by March 17th, 2023 for all existing services, and new services have to be compliant at the time they are enrolling. So we're already going through efforts to ensure compliance for new providers of those services. The underlying principle of the settings rule and goal of system transformation is community inclusion for all participants, to make sure that participants have the same opportunity for access to the community as those without disabilities or those who are not participating in a Medicaid waiver program. So the two services that are most impacted on New Choices are adult day health or adult daycare and memory care in adult residential services. And those are because when individuals are receiving services in that setting, they are often, they don't have uncontrolled egress to come and go as they please. And adult day health for those with dementia, that is often the reason why they are there, to make sure that they have an option to go and do something in the community in a safe way. So with the settings rule, the way to show compliance, even though there are restrictions that most members of the community do not have is to make sure that the person-centered care plan is individualized and modifications like restricting the ability to come and go as one pleases are specific to that individual and are not implemented broadly across all participants, even though it may not be needed for everyone. So this is why, naturally a memory care secured unit works, because there are not individuals in the setting who don't need that service. That is also why there is a review process to make sure that all elements of the settings rule are complied with in the memory care checklist. That checklist is directly moving parts of federal rule into procedure. So how to come into compliance, focus on person-centered care planning, and really looking to ensure that individuals are accessing the community to the degree that they express that they want to, and that services account for that. So we recommend one who is near the end of life, and their goal is to be comfortable and healthy and preserve dignity, versus someone who wants to be very active in the community, not saying that everyone has to have a goal for community integration unless that's what they want. So it very much hinges on the part of that sentence where it says to the degree expressed. So for individuals requiring restrictions, the modification section must be utilized to document that restriction. So what we would put there is memory care restriction, adult day health participation, or any other restriction that is put in place. And that could be things like limited access to the internet because of a health and safety concern, where individuals not receiving services or without a disability don't have that limitation imposed. So it's not just limited to memory care and adult day help. It can be anything in the person-centered care plan that restricts access to something that someone else would have because of a health and safety risk. So the person-centered care planning process is really an opportunity to create a plan of care that incorporates preferences and choice, and is an opportunity for individuals to express the ways in which they want to access the community that are important to them. So facilitating opportunity looks like providing the resources required if that's naturally offered in the setting. So we're not talking about case managers being the ones to drive an individual to an activity they want to participate in. We're really looking at a scenario where an assisted living, as part of their service delivery model, provides transportation to participants. And if that's available to everyone at the facility, then that's an option for that individual to access the community. Now, recognizing COVID makes that different, but hopefully, fingers crossed, we are at the verge of that, that looking more normal. Facilitating opportunity also looks like providing training or support to the individual to access community resources. So things like the public transit system. Someone just needs training on how to access the bus schedules or where the bus stops are. That's something that you can help facilitate. So quickly, there are some questions that were outlined in that video that were really helpful for what could be asked to facilitate that conversation. If we ask the question in conversation of what are your goals, many participants in our program may not identify with the fact of pursuing a goal at this time. But there are different ways you can ask that question, like what do you want more or less of in your life? Who do you want to spend time with? Are there new things you would like to experience? Are there things you would like us to help you consider doing? What do you want to do in your free time? What does quality of life look like? Things like that. So we can change that from what are your goals to something that may be more digestible and easily defined. So the new section to the PCCP is titled My Community Integration Preferences. And there are 4 questions that need to be answered or addressed. They are activities that are important to the individual, supports needed to access the community, how often it is desired to go out into the community, and other considerations regarding access to the community. So resources may involve waiver supports, natural resources, or community supports. And the point is to document how opportunities are facilitated. Again, the important part, to the degree that they express they want to participate in activities in the community. So the PCCP Addendum will be effective May 1st. We are going to be updating the draft that we sent out because you guys called out so helpfully that it says aging waiver on the bottom. Thank you for that. We will be updating that to reflect new choices waiver. So for those care plans and PCCP addendums, or the care planning meetings that you are having in May, start to use that form. For all care plans that have adult day health on it and approved right now, you will need to update those PCCP addendums regardless of when their review is by July 1st, 2021. So you'll have a couple of months to do that. So within your agencies, you'll need to identify those individuals with adult day health approved on their care plan, and then within the next couple of months, have that conversation of what community integration preferences exist. And then all other PCCPs can be updated according to their next scheduled update. Okay, that was the high-level overview. So hopefully you guys have been submitting your questions. We had one question that was previously submitted that says, I watched the included video and it states that PCCPs just need to be updated at their next scheduled annual as we move forward. I have an annual this month that I've been working on. We aren't doing the full assessment because of COVID and Appendix K, but should I redo her PCCP related to this update needed? Or do the PCCPs not need to be updated until we are doing the full assessment again? So if there is adult day health on the care plan, then yes, the PCCP addendum needs to be updated. If not, and you plan on extending the care plan, then the PCCP update can occur at the next time you have the full care planning meeting and the full assessment. So with care plan extensions, we do not expect an updated PCCP addendum unless adult day health is on the care plan. Let's see, an outstanding question. If there's time, would you please speak to non-medical transportation taking clients from different facilities in the same vehicle for rides or errands? I'm not certain this is a great idea. What are your thoughts? That is a great question, one we will have to take back and consider. At this time, it's not prohibited in policy. So if you could share, why you feel like this isn't a good idea, if it's just in the context of the public health emergency and COVID, and that's the biggest concern, or if it's a billing concern, I think that would be helpful to know. Any other thoughts or questions about the PCCP addendum? Oh, HIPAA violation. I guess it would depend on what's being discussed. You know, if they're having a discussion about care planning, then that would not be an appropriate setting. But outside of that, I don't necessarily see that as a HIPAA violation. But again, I don't want to speak uninformed, so we can go back and run that past our security specialist, but I don't anticipate that that would be a HIPAA violation. Well, if there are no questions, it seems like we're feeling like the PCCP addendum update is pretty straightforward, which is great. Or maybe there are some of us that need to go back and watch the video, which is fine too. According to YouTube, there's been 70 views, so it may be helpful for your staff to take a look at that video because it does speak to, you know, what case management can look like. There is an element where it's talking about, you know, the context of policy, but there's also practical application. Excuse me. So unless, you know, you guys want to do that as an agency and provide that training specifically in a staff meeting from you to your staff, you're more than welcome to do that, but this video is a great resource. So I would encourage you to share it with your staff. Might make your job a little easier. And you know, if there are questions that we get regarding this update, our answer will more than likely be, hey, here's this video, why don't you go watch it? We can provide targeted answers, but this is the way that we are providing training. So thanks for the feedback that the video was helpful. That's good to know. So I'll stall for a minute and maybe talk about things that are upcoming in case there are no other questions. We have had a lot of questions recently about what's going on with financial transaction services. So a new vendor has been secured. That's going to be Morning Sun or Morning Star, as it's referenced to in different places. And that implementation is proposed to be effective for May 1st. We do have a training scheduled for April 22nd. It's a Thursday at 10 a.m. where Morning Sun is going to be presenting on the use of their system and how those requests will be submitted. I hope this is helpful. It seems like it's a benefit to us, but there is no longer going to be a paper FTS form. It's electronic submission. And you know, it seems like we have some lessons learned from the couple of years that we've been using FTS and have made some process improvements there. So what I need from all of you is confirmation of who the point persons are for FTS for your agency. So if you could please email me names, emails, and phone numbers for those individuals. We had previously outlined, you know, a main contact and a backup contact. You could send it to us in that form. That would be great. Morning Sun would like to know that. I think they're setting up user profiles, so they're trying to get everything set up in advance. So please email that to me, ldavis@utah.gov. Let's see, we are planning on having another training forum on May 10th, 2021. Content to be determined, but we will send that out. You know, we get a lot of great information at these trainings, so they often inform the next one. And we are so appreciative of your feedback and participation there. But future trainings we will always have on the second Tuesday of the month from 10 to 11:30. We can plan on that occurring, and that will be our way that we are having our annual CMA training for our compliance in our state implementation plan. All right, so we do have a couple of questions coming in. So what are we doing with clients in memory care that do not have a spokesperson and Office of Public Guardian won't pick up? This is a great question, and we've already had it come up before. There is an administrative rule. Let me share my screen. We can also send you the link in the chat. Hopefully you guys can all see that. It's slow going. Okay, so administrative rule for default surrogates says that any member may act as an adult surrogate if the adult has not appointed an agent, an appointed agent is not reasonably available, or a guardian has not been appointed, and the proposed appointed individual is over 18 years of age, has healthcare decision-making capacity, is reasonably available, and has not been disqualified by the adult or a court. So it also describes in descending order of priority who may act as a surrogate. So this is kind of like options to explore before, before it's decided that there are no other individuals to act as a surrogate decision maker. So at that point, the case manager or case management agency can act as that surrogate. So you would run through, a spouse, immediate family members, and it basically comes down to anyone willing to act as a surrogate. So we have had situations where that's come down to the adult residential services provider. We had one recently where it was the case management agency, and after receiving this clarification about what exists in rule, the concern of conflict of interest was removed, and we were able to move forward there. So I'm posting the link to this in the chat. You're more than welcome to take a look at it. If the CMA is not comfortable being the surrogate, then someone needs to be identified. And it is within your scope of work to be the facilitator to identify someone. Okay, so another question regarding visits. I have a client who can't be vaccinated due to previous allergic reactions to vaccines. She is wondering if the case manager can visit outside 6 feet apart and masked. Is this allowed? Yes, it is. So that's a really great solution and a good answer. There is a waiver form for SaaS services that are providing care as a live-in caregiver. They cannot really clock in for each episode of service delivery. I'm guessing this is kind of a question about surrounding maybe electronic visit verification and the requirements for someone to document episodes of care provided. That's a question I will have to take back and staff with the members in our bureau who are doing EVV, electronic visit verification, and we can provide more information there. We do have a project to update the SAS documents and provide more information there. So it looks like something just came in that Morning Sun has an exemption form for live-in caregivers. So Amelia, maybe we can document that and explore this exemption form. Maybe it exists for all FMS agents, and it's just a matter of communicating the solution. So we can do more research there. Can New Choices waiver pay for guardianship services? Unfortunately, there's not a service for that. No. If the question is, can New Choices waiver be paid to act as the individual's default surrogate? That's a really good question, and I don't want to misspeak, so we'll go back and research that and make sure that the Bureau is supportive of that being something reimbursable under case management. So we will find out the answer to that question and get back to you. Any other questions? All right, it was a quiet group today.
Lainey, sorry, there was one more.
One more.
Yeah, just from Rod about the guardianship. Do you see that?
Okay. Oh, yes, I do. Thank you. So the client has no options, and the CMA is not willing to act as the surrogate decision maker, nor is the ALF. Both entities do see it as a conflict of interest. I mean, at that point, then the modification cannot be implemented. If no one is willing to serve as their representative and make choices for them. We do see this this allowance of a default surrogate to be the workaround, where that essentially makes it so anyone can be the decision maker. And if the individual cannot be safely served on the program without the modification and there's no one to act as a representative, then the choice at that point is to reach out to us and have a discussion about moving back into a skilled nursing facility. So I would really hope that there's a solution, and it seems like we should be able to find one. So if that's the case, I mean, Rod, you've reached out to us for this scenario, and maybe that is worth revisiting again, so we can come up with some kind of solution. Where can I find the current SAS forms that are required? We can send out the current ones. They are a little messy and do need to be updated. So we can send out the current forms. I think there's an employee packet and an employer packet, and then a set of service authorizations. We can send that out. Just know that we will be updating it.
Lainey, can I actually request, if you are in need of those right away, just email me, because we are in the process of updating it now. And so if you don't absolutely need the current versions, it would probably be better to wait until they're updated. So this is Amelia. So just send me an email and I'll send those out to you.
Thanks for saying that, Amelia. That's helpful so we don't run into versioning issues. Let's see, is it possible to update the New Choices Waiver website with all current forms? It would be an efficient way to ensure we are always using the current form. I believe we do have all forms on our website, actually. If there are some that you find are not on there, help us and call those out so we can get them on there. I think service authorizations were intentionally left off because we didn't want, you know, there's a little bit of vulnerability there with that may be misused, but we can consider that if that's the one that you're asking about. But most of the other forms should be on the website. Let us know if we're missing a form. And we can put a link in the chat for our website if we're unsure how to get there. What are the qualifications for a case manager in the New Choices Waiver Program? So the qualifications for each service provided for New Choices Waiver has a document on our website under the Providers tab called Attachment B. And you can find all of the expectations and requirements for case management in the Case Management Attachment B. And it describes that Case managers for new choices waiver either need to have an RN license or an SSW license as a minimum, and can have, licenses that exceed that, like an LCSW, the difference between a bachelor's level social worker and a master's level social worker, for example. And then while training, we don't have a set of training content that's required before services are provided. We do hope that you are getting training before you're jumping into the field. There is a training that's required for new nurses that Marisol, the nurse on our team, does. She goes over a level of care training. There are vulnerable forms a shared Google Drive would work. Yes, it would, if Medicaid didn't block us from sharing things with you guys. Because we use our emails for protected health information, Medicaid has disabled the functionality to allow us to share documents with those who have email addresses that don't end in @utah.gov. So we can find some solution though. But if the service authorization is really what you're getting at, we can find an answer for that. Do you have a list of the frequency changes that are care plans so that we can provide to staff so they complete service auths correctly and match care plans? Yep, we can send out the copy of the HCPCS reference grid. The version that was provided in 2019 has had some updates along the way. So I would suggest that you wait for the new version rather than relying on the one that was provided a couple of years ago. So we will send that out. But thank you for being so acutely aware of service auths correctly matching care plans when it comes time for the financial audit. That will make everybody's life a lot easier and happier if everything matches up. Any other questions? Anything else you wanted to add, Amelia?
Yeah, do you want to give them an update on how we're handling care plan assignments? We've made changes to
Yes,
that
I
split.
missed over that. Thank you so much.
Sure.
Let me find my screenshot. So we have made some improvements to how we review care plans and care plans in the system, with the goal of providing faster response for adjudication so that it may no longer take a month for a care plan to be reviewed, and also to reduce the amount of care plan denials, because everyone has the same goal of wanting care plans to be approved the first time around. So one of those changes was programming frequencies so that it removes that element of guessing what will be approved. And then we've also created a queue for each member of my team who adjudicates care plans. And the care plan assignment will stay with them. So when you have a question about a care plan, you previously used to email a member of the team and based on an alpha split. And that alpha split no longer exists. So can you guys see the screenshot, Amelia? Is that coming up? Yeah, okay. So on the care plan summary, you'll be able to see which one of us is assigned as the admin to review the care plan up at the top right corner. So if you have a question about a care plan that you are submitting an annual for, it will stay with the same person. Initial care plans won't be assigned until you actually submit it. So if you have a question about a care plan you have not yet submitted, you can email newchoiceswaiver@utah.gov, and we will triage those questions out across the team. We get a lot of questions of who's reviewing this care plan now. This is the way to see this. And if I think we may have already emailed this out, maybe not. If we haven't, we will email this out to you guys so you can forward it to your staff. If you could communicate this to them, we would really appreciate it so that we can focus on quickly reviewing care plans. It's been going pretty well. Our averages have been staying, 5 days or under for the past couple of months. So hopefully you guys have seen an improvement there, and we'll continue the quality improvement efforts to reduce the rate of care plan denials, since we all have the same goal here. And hopefully we'll never get back to the point where we were a couple of months ago where care plans were outstanding for months. That was, pretty painful for everybody. So, let's see. We sent out, I'm just catching up on the chat here. Can case managers get reimbursed for the cost of using a language line, which is being used when meeting with clients? There is, Medicaid does cover translation services, which I'm thinking that's what this question is relating to. And we've allowed that to occur for, I think it was quarterly for medical discussions. Sorry, I was trying to catch up with the chat and seeing if this question was related. So Wendy, this might be a case where we need to staff the specific case you're working on, and then we can provide an update to the group in case other individuals are also serving someone whose preferred language is not English. Because from what I am aware of, we have allowed the Medicaid covered translation services every quarter for the quarterly face-to-face visit, and when medical needs are discussed. And then outside of that, Medicaid does not reimburse for the cost of translator services. Question, would it be possible to add the service auth to the care plan system like freedom of choice? This has made it much easier with the freedom of choice. Stacy, this is actually a really good question. And you may have heard about this, or this was brought up by somebody in our meetings. Cammie, I think that was you. 20 years ago, we talked about how Medicaid was moving to a new processing system. That system is called PRISM. There is a proposed go live date of, I think it's either January, February, March, somewhere in the first quarter of 2022. And in that system is a top to bottom replacement of the way applications are currently submitted. So instead of paper forms, individuals will go online and submit an application similar to how you can apply for Medicaid through an online system. That work gets routed to us through this system. It creates work baskets for individuals. So you will have a system that doesn't look like the care plan system, but functions the same for care plans, where you can submit care plan requests. It generates a service authorization for you based on what's approved on the care plan. The freedom of choice form is pre-populated in real time, and you download it as a PDF and then meet with the individual to select services at the time you're submitting the care plan, re-upload it as as evidence of person-centered care planning, upload the attachments for the PCCP. One thing I'm really excited about is on our end, we have the ability to approve or return line items. So if there is only one teeny tiny thing wrong with a care plan, we can approve all of the other services and just return that one item back to you for resubmission. Hallelujah, that will be so great, because I'm sure it's frustrating for you guys, to realize after the fact that there was one thing wrong in the list of 20 things, and you got all 19 others right. So we're really looking forward to that. So it will be a top to bottom replacement. We won't need to submit level of care or rental documents through a fax line or the email account that you're sending those to. You won't need to submit records for the annual audit requests. You'll document case management log notes in the system. It does have an indicator for case management utilization compared to what was authorized on the care plan, so you'll know what needs to be updated. Some pretty cool things. So it's going to be quite an undertaking to get everyone trained and up to speed, our team and on the provider end. So we can look forward to that journey later on this year, and hopefully try to make it as seamless as possible. So more training to occur there later on this year, early next year. So are there monthly trainings from now on? That is our plan. We hope to be able to pull that off by providing, real-time updates for you. Previously, years ago, we had quarterly trainings and there were big chunks of information shared, and then we didn't really have a whole lot of interaction outside of that. And we appreciate getting to have a closer working relationship with you all. We realize that we share policy updates as they occur, but we have received so much benefit from having a two-way discussion about policy before it's implemented that we want to keep doing it. So what started as just us telling you about what we were doing is now morphing into more of a work group style where we're going to discuss policy that's going to be implemented, get feedback. There may be those instances where for the objectives we're trying to accomplish, we can't accommodate all recommendations that we get, but we do want to we want to find workable solutions. So yes, monthly trainings. We are hoping, the PRISM system lift is going to be pretty significant, but we are hoping that this year we will be able to provide training in almost every subject area that we have for the program. Earlier this year, Amelia sent out a training request survey and you guys identified key topic areas. It was basically all across the program. So we hope to do that through a person-centered care planning lens, so that we have a better understanding of person-centered care planning. And it may be helpful for us to see examples of care plans from some of the DSPD waivers. I've seen a couple of those, and while they have some elements that we don't need, it seems like they've really embraced the person-centered outlook, and the work that they do embraces that, where maybe the work that we do is just checking a box for the PCCP addendum, and finding solutions together for what the most active participant looks like who wants to be involved in the community, and going through case examples of what we could do for that individual, and then also what we could do for the individual who doesn't identify with having a goal or can't verbalize a goal, or for whatever roadblock exists, what do we do with that? So we can find solutions there. So that's something to look forward to this year as well. If you have any input there, we'd love to hear about it. So a couple more questions. Last meeting you mentioned the TN modifier can be used for case management. Has any case manager been billing for this modifier? A good question for the group. I don't know if it's risky to tell you to unmute if 50 or however many of us are going to start talking all at the same time. So if you're brave enough, you can unmute and let us know, or you can throw it up in the chat and maybe you guys can connect. All right, silence. Okay, throw it in the chat. I started using the new PCCP for 4 annuals. I did this week. Do I need to redo them? I'm guessing this question is for to accommodate the update we're going to make that just says new choices waiver on the bottom. If you've already done it, there's no sense in doing rework. Just use the new form when it comes out on the next one, please. All right. If we have current FTS payments that keep getting rejected by Acumen, should we wait till after the training to submit it to Morning Sun? There is going to be a process after the transition to Morning Sun that Acumen is going to undertake a significant effort to get everything caught up. And we have a member from the Bureau or the state Medicaid agency. Her name is Linda. For those who also work with aging waiver, she's the liaison for that program and has a lot of claims experience. So she will be helping in that effort. If it's helpful, I've considered asking Acumen if they would have a representative come to our monthly forum and share with us their plan and instruction for what needs to occur. So if there's interest in that, that may be the best way to disseminate the fastest information to let us know there. But yes, there is a plan to get everything caught up. I don't believe the intention is for you to resubmit requests to Morning Sun. I think if you've already submitted it to Acumen, it stays with Acumen. But Amelia, let's clarify that. If you can note that for us, that would be so helpful. Thanks. Where can we find the recordings of these past trainings? So let me find the landing page for that. We have a channel, DMHF_web DOH. And currently there are 6 videos on there. Several settings related videos, Medicaid statewide provider training, and the Appendix K Q&A Part 1 and Part 2 that we did. So those are available for viewing. And Amelia, I can't remember if these are linked on our website or not.
They are. They're under the links setting on the website. It does take us a little while to get them posted. So we're working on a way to figure out how to get these out quicker.
Any other questions? All right, well, looks like you get a half hour of your day back. Really appreciate the participation today. Let's see, when is the training or call with Acumen? Okay, so there is interest in that. I'll try and coordinate with Tricia Hansen and see if we can get something set up. I'm guessing that may be something that happens in June or July. So we will work on that and keep you posted. But in the meantime, please try and remember to send me your FTS contacts for point person and backup. We've been getting multiple denials for payments from last year. yes, I have become aware that this is something that is shared by all of you, that there are outstanding requests in significant amounts, and that it's been concerning for a while. So we are going to work through all of that to find timely solutions. So be patient with us, but just know we are investing in that effort to help as well. Thanks for having these trainings with us. You're welcome. This has been kind of fun for us to have more of a relationship with you guys. If there weren't so many of us, it would be fun to unmute and chat, but I'm sure we've all been in those awkward meetings or seen that YouTube video that's a parody on virtual meetings, and we don't want to do that. So anyway, thanks for your time, you guys. We really appreciate all of you. And we will send out the invite for the March 22nd training for FTS. And you can forward that to your FTS point person and backup. So have a great day, everybody. Talk to you next time. Bye.